I've been thinking and writing a lot about contraception, and as much as it's this social and economic issue, it really can have a huge environmental impact as well. So right now, the absolute greenest thing that I can do is to not have a baby until I'm 100% ready.
So what's the most important thing to you about birth control?
I do not want to have any kids right now.
Okay.
But I do want the option of little Eves in the future.
Okay. Then we should talk about the long-acting reversible methods because they are equivalent to sterilization in terms of pregnancy prevention.
Okay.
So those methods are intrauterine devices, or IUDs, or the implant, contraceptive implant.
You haven't brought up birth control pills as a long-term kind of birth control option.
You have to take a pill every single day. When you look at how birth control pills are actually used by women versus how IUDs and implants are actually used by women, birth control pills are 20 times less effective at preventing pregnancy. They are the most commonly used method of reversible contraception in the United States. 8 years ago or so that you were first interested in being on birth control, we were just starting to see an increase in the use of IUDs. I mean, I think we can help with that, but women often listen more to their friends and other women than they even do to their doctors. So IUDs are placed, again, through the cervix into the uterus. They're these long-term devices, but it's easily removable whenever that person wants.
Okay.
We have IUDs that are medicated with copper. The implant is a 4-centimeter kind of rubbery looking rod, about like that.
Okay.
That gets inserted under the skin and it takes about 30 seconds.
Okay, my number one priority is not having a kid right now. Never thinking about my uterus. I love my uterus. I don't want to think about it. What would you recommend as the best method for me?
With the 5-year levonorgestrel IUD, not only does it work excellently at preventing pregnancy, but it decreases periods significantly.
And what are some things to know about having the IUD in you every day?
Different women react differently to having an IUD in place. It can be crampy. Complications typically include heavy bleeding, risk of infection, and then risk of damage to the uterus. However, that risk is really low. A lot of women think that they need to come in and have a pre-visit to talk about an IUD, but we have lots and lots of data to show that it's perfectly fine to make a decision about an IUD and have an IUD all in the same visit.
That's great.
So we'll do that today.
Right now.
Yes.
How do you feel right now, Eve?
I'm not gonna lie, feel a little crampy, but honestly the whole thing took less than 10 minutes. It was a very brief procedure. I know that McDonald's is the opposite of a Grist approved food institution, but I just had somebody open up my cervix and put a little piece of plastic inside of it. There, Brian.
We got it.
Oh my God, is this for real? Because I feel like I just became a woman taking control of my reproductive health and reproductive future. This is the day my life changed. I'm gonna consult Dr. Prager for how to run my affairs in general. Life affairs, not romantic affairs. Although I'd take her advice there too, honestly.